Are repeated calcitonin tests always necessary for monitoring? Imagine you've been diagnosed with medullary thyroid carcinoma, or MTC, and your doctor has explained that calcitonin levels are a key part of your follow-up care. But you might wonder, do I need to keep getting this test over and over? The answer depends on your specific situation. Calcitonin is a hormone made by special cells in the thyroid called C cells. It's mainly used to help diagnose and monitor medullary thyroid carcinoma because these cancer cells produce more calcitonin than normal. For most other thyroid conditions like hypothyroidism or hyperthyroidism, calcitonin isn't routinely measured. When doctors first suspect MTC, they often order a calcitonin blood test. Usually one test can give important clues. If the levels are high, additional tests might be needed to confirm the diagnosis. Sometimes, stimulation tests with substances like calcium or pentagastrin are used to see if calcitonin levels rise further, which helps clarify the diagnosis. But not everyone with a thyroid nodule needs this test. Current guidelines recommend testing only in specific cases, especially if there's a family history or genetic risk factors like multiple endocrine neoplasia type 2. Once MTC is diagnosed and treated, usually with surgery, calcitonin becomes a vital marker to check for any signs of the cancer coming back. After surgery, doctors often measure calcitonin regularly to see if levels stay low or if they start to rise again. The frequency of these tests depends on your individual risk. If your initial treatment was successful and your levels are very low, your doctor might schedule tests less often. But if there's concern about residual or recurrent disease, more frequent testing is common. It's important to understand that repeated testing isn't always necessary for everyone. Overdoing it can lead to unnecessary worry, false alarms, or even invasive procedures. The decision to continue testing should be personalized, considering your risk factors, how well your treatment went, and your overall health. In general, repeated calcitonin tests are most useful after an MTC diagnosis. For other thyroid conditions, they are rarely needed. Always discuss with your healthcare provider to determine the right testing plan for you. They will weigh the benefits of early detection against the potential downsides of unnecessary tests. So, to sum up, you don't need to get repeated calcitonin tests constantly. They are essential in monitoring medullary thyroid carcinoma but aren't typically used for other thyroid issues. The key is personalized care. Your doctor will guide you on how often to test based on your unique situation. Remember, always consult a healthcare professional for advice tailored specifically to you.